So, after watching your video about nursing understaffing and patient safety, I feel that you explained very well how proper staffing improves patient outcomes as well as lowers mortality rates. I also thought you made very strong points when you discussed floating nurses as well as evoking safe harbor as ways to manage unsafe patient assignments for nursing or for nurses. I'd say that understaffing is most definitely a major issue in healthcare. It impacts both the patient and the nurse in many different ways, in many serious different ways. And I'd like to say that I do agree with many of the points that you discussed, but I would like to present a different ethical perspective instead of focusing on mainly the benefit of floating nurses or evoking safe harbor and safe harbor protections and staffing ratios. I want to discuss some ethical concerns that can happen when healthcare organizations rely too heavily on these strategies as solutions for understaffing. I want to talk about float nurses. So, float nurses, they can definitely be helpful when staffing shortages take place. They fill in the gaps, the care gaps with with the units that are short staffed, and then they're often used as a quick practical solution to maintain staffing numbers. However, floating also creates safety concerns for both the nurses and the patients when the nurses are floated to units that they're not familiar with, or it's outside of their training. They're either not familiar with the equipment, the policies, or just not comfortable in general with the specialty or the patient population. It can be very stressful for these float nurses, and it can increase the risk of having more clinical errors or mistakes. So, with that being said, this would connect to the principle of non maleficence from the ethical standpoint, which it means non maleficence is to have the responsibility to not cause harm or to do no harm. Nurses are expected to provide, competent, safe care to patients, but it becomes difficult when these float nurses are placed in environments outside of their training experience. So I found research supporting this concern. Studies showed that well, nurses working outside of their specialty areas experience higher stress levels and of increased risk of medical errors, which negatively affect patient safety and outcomes. Although float nurses help maintain staffing coverage, it may not always support the highest quality of patient care or support a nurse's confidence in their clinical role. Another topic to consider is safe harbor protections. I'd say that Safe Harbor is an extremely valuable tool because it allows nurses to formally, document unsafe assignments and advocate for their patient safety. It helps nurses maintain professional accountability when it comes to protecting their license. When they're assigned workloads that can be unsafe, Safe Harbor supports ethical nursing practice by encouraging nurses to speak up when their safety is at risk. However, there's also an ethical concern if Safe Harbor is used so frequently rather than as a last resort protection. This situation connects to the ethical principle of justice, which focuses on fairness and shared responsibility within healthcare systems. So, healthcare organizations have the ethical responsibility to provide safe staffing levels and safe working conditions for nurses. If a nurse repeatedly relies on safe harbor protections to protect themselves from and their patients, it can indicate that it's a deeper system level staffing problem that is not being fully addressed. Or Safe harbor is also an important protection for nurses, but it shouldn't replace taking accountability for developing long-term solutions. So now I want to discuss mandated staffing. ratios. Staffing ratios are often supported because research shows they can improve patient outcomes and reduce nurse burnout, but having limits on patient assignments can help nurses provide safer, more focused care. However, strict staffing ratios don't always reflect the patient's complexity or their acuity level. For example, caring for 4 stable patients is much different than caring for 4 critically ill patients who require continuous monitoring, complex interventions, and frequent reassessments. So I'd say that this concern relates to the ethical principle of beneficence, which is focusing on promoting the best possible outcomes for a patient. So evidence suggests that flexible staffing models that consider patient acuity, it considers the patient acuity, the nurse experience, and the available support may provide safer and more effective care than strict numerical ratio alone. So ethical staffing decisions should focus on individualized patient needs rather than only on fixed numbers. So the ANA Code of Ethics supports these ethical responsibilities. The code states that nurses have a duty to protect patient safety, maintain professional competence, and advocate for safe practice environments. While nurses play a major role in patient advocacy, healthcare organizations also share responsibility for ensuring safe staffing and providing resources that support nurses in delivering high quality care. Addressing understaffing ethically requires a long-term workforce planning. It requires nurse retention strategies, a supportive work environment that helps prevent unsafe staffing situations from occurring. So in all, in conclusion, I agree that nursing understaffing is a serious issue that affects patient outcomes, nurses' well-being, and overall healthcare quality. However, strategies like floating nurses, evoking safe harbor, and strict staffing ratios can create ethical concerns if they are relied on too heavily as primary solutions. So floating nurses may impact competency and patient safety. Safe harbor may highlight deeper system staffing failures, and strict staffing ratios don't fully reflect patient complexities. So ethical nursing practice requires healthcare organizations to develop a long-term sustainable staffing strategy that supports nurse competency, fairness, and high-quality patient care.